Haley. So, I am Manvi, and we are in a cancer healing journey talk today. Haley is an ovarian cancer survivor, and today she'll be telling us about her journey that she went through while she was suffering from cancer, and this is going to help others who are going through the same journey. They'll get to know what they should do and what they should not, and what kind of motivation that they can get from this. So, Haley, over to you. You can let us know how you got to know about the disease and how you went through the treatment.
Hi, Mani. First of all, thank you for inviting me here. And it feels really great to contribute in unobvious ways that you can, especially during the times of COVID. So things get a lot worse during this time. But cut it short, I'll start with my journey. So I was 17 when I got diagnosed with ovarian germ cell tumor. I just began with my college first year, and I had come home for weekends, and all of a sudden I got terribly sick. Initially, I did have hormonal imbalance and other issues going on, but that was like in the background. That was not much bothersome that it would make me think that it could lead to something like this. I felt terribly sick, and I was rushed down to the hospitals. I went through a lot of the family doctor and gynec and everything, and they all were like, this is something major. This is something major. I went through all the scans, PET scans, and all the cancer markers and everything. And I met the oncologist, and he broke out the news to me that you may have cancer. And after the surgery, when you observe your tumor, we get to know what it is and exactly how it is. And so it was in the mid-August, and I remember it was my brother's birthday and we had my surgery. And the surgery went for a great amount of time. And after the surgery, it was that I was in ovarian cancer, teratoma 2. And yeah, the treatment, I had to undergo chemotherapy after that. There were no radiations or others. There was chemotherapy, and I had 6 cycles that went across the time of almost a year's time, and several other post-cancer treatments that had to been going on through port and other things that had been installed, those installation and then the removal surgeries and along those. So yeah, the period was more of mentally challenging rather than physically. So yeah, and I had my college years, so I did not take a break, and I wanted to continue and did not let this thing bring it down or something like that. So I continued my education along with the treatment. Yeah, that's my big story if you want to cut it short.
Okay. So, how old were you when you were diagnosed with ovarian cancer?
I was 17.
Okay. So, you were going through your college studies while you were also taking the treatment.
Yeah.
Okay. So, you told about the first signs. So, what were exactly those signs that you thought that you should get it checked from the doctors, and it said you thought it to be alarming and you should get it checked.
Hmm.
What were those signs?
The funny thing, yeah, sorry. The funny thing is that ovarian germ cell tumor does not have any specific symptoms or alarms that you should be watching out for. It just happens and it's so laid back. You might have normal hormonal imbalances and all, and until it happens, your doctor, even your gynec, would not know that these could lead to cancer. So they
Yeah.
are very like passive, and until it hits you and until you get terribly sick, you wouldn't even know that you are having cancer. So like breast cancer has it, that you might feel alarm or heaviness in your breast or something like that. Ovarian cancer does not. And even if it hurts, you might think that these are normal period cramps. So it's
Yeah.
very laid back and passive.
Mm-hmm.
So I had already been undergoing hormonal imbalances and had been getting treatment for them. But that was like every other teenage girl at that age was going through that phase.
Yeah.
So it wasn't much of concerning back in the days. So something that my gynae would warn me around about or something. I was just on hormonal medications and that was going on. And this came all of a sudden. But yes, we should, like, if anyone is going through any hormonal imbalances, they should definitely have a watch on it and try to balance it out. And rather than relying more on medications, try to regulate it with your food and exercise and health wise. The natural way you go, the less you need to suffer. Because if you keep on taking the medicines, you will just hang a blind like, yeah, I'm in check with my doctor. I have things going on. So you would not know until it comes through on your face.
Yeah, I agree. So, how did you, give out this news to your family and to your dear ones that you're having this issue, and how did they take this news when they heard it?
Hmm. So when I felt sick, my parents weren't home. They had out for some trip, and I was at my uncle's place. So the starting procedure, it went on, and my uncle and auntie took me to the hospitals and got the scans and everything done, and my parents had to fly down. And my parents were together, and it was doctor first broke the news to my parents, and then they told me. I mean, they didn't even tell me directly because I was just 17. So they thought this would be really scarring for her. So they never mentioned the word cancer. But I was curious and I went through what the report and this and that, and I read and researched on it, and I'm like, okay, this is cancer. They are trying to sell me the same story, different way, so that I'm not hurt. So they were very considerate of it. And so the word that you are diagnosed with cancer never came up in my journey. But we were all kind of silently dealing with the thing. We all knew, but it's like, you don't know that I know that you know kind of situation.
I
So
think
yeah,
that
it was like that.
that keeps you going, and you don't really
Mm,
let yourself, get bothered with the fact you should actually fight,
mm,
and that's what you did.
mm.
So yeah, so what were the series of treatments that you took, and what out of them actually helped you with recovering?
Um, for my thing, first of all, we had surgeries. Tumor was removed, and it weighed around 1.5 kgs. It was huge. The tumor is quite huge, and yeah. So first surgeries were done, and after surgery, post-op, the stents and all were put in my body, and I was put on observation for a few days, for several days. And then when my body, the stats became normal, we started with chemotherapy. So the chemotherapy each lasted for like a week's time, and then after the period of 45 days, I had another chemo cycle. So I had around 6 chemo cycles throughout, and along with chemo cycles, I had other treatments going on. A port was installed within, and the other vital drugs that were needed for me, because in the middle, my body kind of broke down. We kind of had, like, my body was not sustained really well with chemotherapy, and along with the side effects. So we had to pause it for a while, and other things were going, kept on going. The certain vials and important whatever nutrients my body needed, they were continued along with it. And along with that, for like, I was an avid reader, and it was affecting me mentally. So to keep up my mind sane, I read a lot and this different things, and I read about almost every celebrity or known person who had their cancer journey, and whoever had their book or movie made on it. I kind of watched that, and it was kind of cathartic for me. And I myself, I'm a mental health student, so I'm a clinical psychologist, so I was studying psychology. So that really helped me. And that was a phase when I was changing a lot, physically, mentally, emotionally. So that was like whole carving your different personality, like getting to know yourself better, the present now, and all those. So the journey was quite of challenging, more of emotional, mental for me rather than physically. Because physically we had it too, that we have certain rounds of chemotherapy, this and that, so it was all planned out. But this, it was like hurdles.
Yeah, and yeah, this happens. So you must be having many side effects because of the treatment that you were going through. Were there any?
Yeah, like the Above all things, the hair loss. Before I had really great hair, they were thick. Even each single strand, it was thick, and even the voluminous was there. Like I had hard time washing them. And then after chemotherapy, my hair did not grow for several, like good 1.5 years.
Okay.
So like, and yeah, and they were also very scanty, and they didn't grow as they used to be. Like they are like 1/100th of what I had. Like if you see
Mhm.
my pony, it's like really small. That is one side effect. Other than that, there was a lot of mental fog and what you call as chemo brain that went for a good a year's time. Where like sometimes you just have blank points and it's difficult for you to remember things. And the cognitive functions they kind of slowed down or cracking.
Okay.
Another side effect for that would be I had kind of patches all over my body, like skin patches, like people who have hormonal issues and they have darkening of the skin around. That was one thing. But that came down within a few months' time. I mean, 6 months to a year's time.
Okay.
Yeah, so those were the side effects. And those are also rapid weight loss and weight gain. Like I used to gain and lose around 20 kgs. So it was so difficult to put up with things, especially to people who are not close. So they would see me once and I was having a normal body. They see me next month and I have dropped down and as if I was skinny. And then they see me after 2, 3 months and I've gained the weight like a different person. So that was very hard to explain to people.
Yeah.
So yeah, there was major weight gain and weight loss.
Maybe that was all a side effect of the treatment.
Yeah, because of, like even after the treatment got over, I was put on meds. So even they have their side effects going on.
Yeah. Mhm. So, did you also, choose any complementary therapies or any other treatments like Ayurveda or maybe something else that you felt helped with you, or was it
Um,
only allopathy?
yeah, no, we stick to allopathy only. We didn't try anything. But I was suggested to have a protein-rich diet back in the days. And everybody insisted that I should have protein powder and stuff. But I was really not into protein powder, so I went the natural way and tried all the possible ways of protein-rich food, eat legumes or the sprouts or anything. And that was also a time when I was learning about veganism, and I had started making baby steps from non-vegetarian towards vegetarian, and eventually now I'm a vegan. So
Okay. So,
that was the time when I was discovering things, and I started speaking. Hmm. It was actually really helpful for me, for my body, because if you see a vegetarian diet was much sustaining as compared to non-vegetarian diet on my body as well as the digestive system, which helped me feel the energy levels and otherwise.
okay, so basically, changing your diet and making it more protein rich helped you a lot.
Yeah.
Yeah. So, what did the doctor suggest any other types of therapies that you could get? Maybe anything else that you considered apart from reaching out to the doctor? Any kind of therapy?
No, doctors did not suggest, and they were like, I was fine and I was having good results after the minor change in my treatment. And I, even my parents at that time risk, did not think it was worth risking trying some alternative methods that could, mess around with the treatment that we're having.
Mm.
And like I'm the youngest daughter, so they did not like even if I wasn't youngest, they don't mind messing around with things that they are not sure of, especially if things are this critical. So no, we did not do any alternative methods. We stuck to what the doctor suggested.
I think that was a good decision that you took because yeah, it had actually helped. And now you're better. So how long has it been since you've been cured, and what steps do you take now to keep yourself healthy?
It's been 5 years now, and over 5 years of time, a lot of things changed, dietary wise. physically, mentally. I even went for therapy sessions. Mental health therapy sessions. I changed my diet from non-vegetarian to vegan for health as well as animal and environment. And I also started practicing yoga. I mean, that was the period I started. I was into yoga. I just got to know about practicing yoga and things happened. So then it was like, an extra push for me to further pursue yoga. And I have been practicing yoga for 5 years now. So
That's
that, and also a lot of knowing about myself before what I was before cancer, during cancer, and after, so that I could literally see myself as three different person and how to better myself as an individual from cancer journey. Because when you are when you just get done with your cancer, going through cancer, there's so much of change in your environment that you do not know how to exist. Like if you ask any cancer patient, they will find it's like they do not know of themselves. They even don't know how to like connect or be around with people who are familiar, even if it's family. It's so hard for you to connect and have even a normal, be in one space with them because the environment is so changed and you are in hospitals all the time, surrounded with doctors and nurses, and mostly it's hardly one person that is allowed to be with you only for certain hours. So you are in your own hide. You have made the beds and the mattresses and stuff as your comfort, and you're so used to seeing things around. And for somebody like me who had put myself into books and movies and everything for comforting and finding the same environment, it's really difficult. So that way, gaining composure again, learning your ways to stand up and rise and be around with it, and finding your composure, your way to put yourself out in society. Yeah, that all plays a major role. And changing dietary lifestyle, yoga, taking therapies, and a lot of even before therapies, I did a lot of work on myself. And when I had the breakdowns and stuff, and that's when I realized I need some professional help, and I went for therapy sessions, which really helped me point in the directions I need to be working on. Yeah, those were the lifestyle changes that's from then to now.
actually, I'm actually really intrigued to know that you told about the mental therapies and the help that you took to keep yourself mentally healthy. And it is something that is very important for a cancer patient because they go through a lot while their treatment. So,
Yes.
what would you suggest to other cancer patients who are going through the same, how they should keep themselves mentally fit apart from physical fitness, what kind of steps they should take so that they can keep themselves happy and motivated to go through the journey.
Just just a second. What happens when we are undergoing chemotherapy and chemotherapy or any treatment is we shut ourselves down and we are constantly obsessed with the thought. And it comes very naturally. You cannot stop thinking about things. And mostly it's about the future, and sometimes you go in the past. So the basic common symptoms person goes through is depression and anxiety. That anxiety, you are so anxious about what things are going to be around and how is it going to be. And mostly you have fear of that. Will I survive it? And how I will be perceived after the world, when I go out, step outside, how I will be perceived, and are things going to be normal? Like we are so much occupied with thinking how things will get back to normal. But it is to be it's needed to be understood that things will never be normal. It's be something different for you now. It's not going to be the old normal. You will have a normal, but it will be a different normal for you now because now you have had that one part and you have been through that journey. So a lot of it comes with occupying yourself with things that makes you feel better. We need a lot of occupants because if you do not occupy and you shut down yourself, you are going to have those thoughts. You need to do something that makes you feel better, something to look forward to. Do not shut down yourself from people who are trying to approach you. It might be uncomfortable, but you need to have a little connection, else it gets more lonelier there.
Yeah.
Another thing is try in the minimalist ways. to move around a little bit. Don't be sticking to your bed. Even in the room, if you are move around, feel around. Like if you have the luxury of having a window that has sky and you can look around to the surroundings, do that. That helps a lot actually. Like rather than seeing a wall or rather than seeing a screen, it's better to have look outside. You can get a greater perspective. You look at the fresh life there. Yeah. And talk to about things how you feel. Always address like normally the conversations of the cancer patients like I'm worthless or I feel like shit, but I'm shit. But they do not rather frame it like, I feel certain way because XYZ. You need to have a conversation. You need to put out everything because we get into the pattern where we do not want to talk and a lot of things keep on coming. The things you can do is maybe write it down or put it out. But engage yourself in different things. So these are the certain things you could do. And yeah, keep yourself hydrated and eat well. Those two are also the reasons why, if you have not eaten well or if you're dehydrated, that too affects your thought pattern and your mood. Because that time already your body is cutting down on the cells, it is shrinking your body down. That is affecting you physically, mentally. And if you're not hydrated, if you're not hungry, it will imbalance the hormones in your body, the anxiety, on all the process that goes on in your body. So you need to keep well that you are hydrated enough, you have enough food, and yeah, try meditation. That really helps. You don't have to be amazing at doing it. Just do it for 5 minutes, 2 minutes, 15 minutes, and that's enough. Whenever everything gets too much, try doing that, or just close your eyes and just let everything go out.
Okay. I think these are some really
Yeah.
great tips that can help someone going through the journey. So, lastly, is there any parting message that you would like to give out to others? That can, a small tip that you would like to give others who are struggling from cancer.
I would not tell them that be strong or this and that, like how everybody says, because this is exactly a time where you do not have the facility to be strong. You are going through things. You will feel things. Just feel whatever you're feeling and carry on. Take one step at a time. You don't have to be strong. Who are you going to be strong for? You don't have that they have to be strong. Deal with one emotion, one feeling, whatever you have going on, one step at a time. And you do not have to force yourself to be in certain way. You already are going through certain things. Your body and your mind is already going through things. So don't force yourself to put yourself into another strain to be strong with this wise. Just make sure that in this moment, whatever you're feeling, you feel like try to feel a little better. Just sail through it. You're going to sail through it. And yeah, good things happen to good people. So yeah, you will get through this. You do not have to pressure yourself to be strong for anyone. Don't do it. That's the worst thing that somebody can ask for. Like, be strong. How am I supposed to be strong? I'm already going through things. It's like one day, one step, one at a time. That's what I would like to say to them.
That's really great. So I think we are at the end of the discussion now. Thank you so much, Haley, for joining us today and helping others who are, they are looking forward to these motivational journeys, and you've come out to it within it strongly. So yeah, thank you so much and all the best.
You're welcome. Thank you. You have a good day.
Thank you.